cruciate ligament, or ACL tear, in the dog is the most common cause of hind limb lameness. It is particularly common in larger breed dogs like Labradors and Rottweilers, but it is also quite common in small dogs such as Poodles, Shih Tzus, Bichons, and Dachshunds. This video will focus on cruciate ligament injury in these smaller breed dogs. Cruciate ligament injury is often seen as a sudden acute injury that the owner would only notice if they were present at the moment of injury. It can happen with a rapid turn, a step into a gopher hole, a slip on the ice, or sometimes just a sudden turn on the hardwood floor. Diagnosis can usually be made with history and physical exam. The history of a sudden onset, non-weight-bearing hind leg lameness, along with a toe-touching stance, are consistent with cruciate ligament rupture. The veterinarian is often able to confirm the diagnosis of cruciate tear with palpation of the knee joint and a test called the drawer test. In this test, the doctor tries to move the tibia bone in a drawer motion in relation to the femur. When the cruciate ligament is intact, there will be no drawer motion. With an acute cruciate tear, there will be significant drawer motion. A positive drawer test confirms cruciate ligament tear. For best long-term function, dogs over 25 pounds almost always benefit from surgical repair. However, a percentage of small dogs can do well without surgery, depending on the degree of injury and lameness. Our initial recommendation for small dogs with cruciate ligament tear is strict rest, laser therapy, and anti-inflammatory medication for 2 weeks. If we see improvement at 2 weeks, we will continue rest and start rehabilitation in the underwater treadmill. If no improvement at 2 weeks, then the patient will likely be a candidate for surgical stabilization of the knee. At the Ballston Spa Veterinary Clinic, Dr. Andersen uses the lateral suture or extracapsular technique to repair the knee. This technique uses a heavy-duty nylon suture to replace the function of the cruciate ligament. The surgery starts with sedation, placement of the IV catheter, and the tear is confirmed with palpation. X-rays are taken to assess the knees and the hips for arthritis and dysplasia to have full knowledge of the patient's hind limb condition prior to surgery. The approach is from the lateral or outer side of the knee. Incisions go through the skin, the lateral retinaculum, and the joint capsule. The joint is inspected for ligament and meniscal injury. If the meniscus, the protective pad that lies between the two bones, is torn, the damaged portion is removed as it is a source of pain. Remnants of the torn ligament are removed. The joint is flushed and closed. Then the stabilization system is installed. A hole is drilled in the top of the tibia. A stainless steel bone anchor is inserted into the femur. A strand of the nylon suture is passed through the anchor, under the patellar ligament, and back through the hole in the tibia to complete the loop. The line is tightened and fixed with the Securos crimping system. A second line is passed in a similar fashion around the bony bump in the back of the femur as an anchor. Once stable, the lateral retinaculum, a strong tendinous layer, is closed in an overlapping manner to further tighten and stabilize the joint. The skin is closed in a routine manner. Post-op x-rays are taken to confirm anchor position. The knee is iced and lasered. Post-op care involves icing twice daily, oral pain medication, passive range of motion exercises, and laser therapy. After the 2-week recheck, we always recommend rehabilitation in the underwater treadmill, typically twice a week for 5 weeks. These patients do great after surgery. For best long-term results following cruciate ligament injury, we recommend regular exercise, strict weight control, and Dazoquin joint supplementation for life. For more information, please call the Ballston Spa Veterinary Clinic at 885-5650 or visit us on the web at ballstonspavet.com.